Ladies and gentlemen, welcome to the Rogers Kakasunguro YouTube channel. Raila Odinga and his brigade is in Addis Ababa ahead of the voting of the AUC chair. We wish him all the very best. If he wins, all the best. If he doesn't, let him come back to Kenya here and we continue with liberating this country, because the Kenya needs us more than how Africa needs Raila Odinga. Back to politics. The Minister of Health is really joking with the health of Kenyans. A very sensitive issue like human health is not something one should play hide and seek with. It's a very serious issue that should be treated with urgency. Human life. Above everything in this world, life takes the top position. That is why when we had floods in Kenya, people fled to rescue their lives. People didn't care about the television sets on their walls. People did not care about their cars parked outside. People didn't care about the expensive sofa sets and beds. People didn't care about the expensive wall units. People didn't care about the expensive houses. People didn't care about their suits in wardrobes. What they did is to flee to rescue one very important thing: life, maisha. Ladies and gentlemen, Citizen TV did some news yesterday evening, and this is what they told Kenyans.
Tonight, the Ministry of Health is appealing to Kenyans to pay up for social health insurance to ensure uninterrupted medical services. Director General of Health, Dr. Patrick Amoth, says out of the 19 million Kenyans registered on SHA, only 3.3 million Kenyans are contributing to the scheme. Our very own Njoroge Gatete has more.
At the weekly briefing outside Afya House, Health Cabinet Secretary Deborah Barasa and Director General of Health Dr. Patrick Amoth brought to the fore the financial troubles at the Social Health Insurance Fund. The number one being Kenyans' contributions to a scheme meant to offer medical services to all. Out of the 19.4 million Kenyans registered on SHA, only 3.3 million are contributing to the scheme.
Health services are expensive, and we cannot only have those informal employment bearing the burden of the rest of the Kenyan population. So we appeal to everybody who has registered to ensure that they go through the means testing process, generate their premium, and actually commit to pay that premium.
With the low contributions, the ministry officials say this leads to disruption of services and wants all Kenyans to shoulder the burden.
We are working with the counties in northern arid lands which have reported low cases of registration to be able to ramp up registration so that in our journey towards universal health coverage through the TAIFA healthcare approach, no one is left behind.
In their pursuit to offer what they term as more inclusive and responsive healthcare to Kenyans, following complaints over system glitches and tariffs, the Ministry of Health has established the Benefits Package and Tariffs Advisory Panel to be based at University of Nairobi, which will, among other roles, review the benefits package.
The panel will serve as a critical advisory body to guide decisions around the social health insurance program. The panel brings together experts in health economy, epidemiology, actuarial science, and health science. Their mandate: reviewing and recommending health benefit packages to ensure comprehensive care, advising on fair pricing and tariffs for health services.
According to the Ministry of Health, 8,813 out of 17,755 health facilities, representing 56%, have enrolled with SHA. Over 1 million Kenyans have accessed primary health care services since October 2024. In reducing pre-authorization time, which was one of the key challenges, Barasa says processing time for pre-authorization requests has reduced from 10 hours to about 1 hour 15 minutes. Gatete Njoroge, Citizen TV, Nairobi.
Now, as you can confirm, it is crystal clear that the Social Health Authority is unable to fund itself to meet the needs in our various hospitals. Out of the 19 million registered as per the data from the Ministry of Health, about only 3 million have made their payments. Why is the turnout so low? The clueless government is unable to ask itself critical questions. Instead of shouting to media and Kenyans, they should go back to the drawing board, they should go back to the boardroom and ask a very simple question. Out of the 19 million Kenyans, why are we only having 3 million contributing? It's a question you should ask yourself. Now, Kenyans are not contributing to the Social Health Authority because of a very simple reason that needs to be sorted by the Ministry of Health. Kenyans have no confidence. Kenyans have no trust. Kenyans have lost hope. Simple. That is why Kenyans are not contributing. Now, when the government finds that very simple answer, it should move to the next stage. Kenyans have lost faith. Kenyans have lost trust. Kenyans have lost confidence. As a government, how do we make sure that Kenya trusts the Social Health Authority? I don't know who advises this government. I have told them several, let them employ me, pay me. I advise them for 1 year. Yeah? Because a whole ministry cannot run a survey to try and understand why Kenyans have refused to contribute. A whole ministry cannot hold a public participation to ask Kenyans, why are you not contributing to the insurance fund, the health insurance fund? I know you and me have one common answer. We do not trust the insurance. I have a patient in hospital and I have a bill of 100,000. I apply for SHA. Then SHA tells me we will only pay 8K, yani shilingi 8,000. 8K, 8,000. Now ask me Kaka Sungura, niende niuze shamba or I borrow or take a loan nikuje nilipe hiyo 100,000. Nikitoka hapo kwa hiyo hospitali, do you think I will go back to contribute to SHA? Because I've already lost trust. I don't see if it's helping me. That is what the Minister of Health should do. But because we have a government that wants to make money, because we have a government that is doing business with our own health, they can't reason to that level. And that is why you see Kenyans have declined to pay. And we will continue declining until you get it right. We are not going to pay very soon. Let those who have pay slips continue paying. Lakini hawa wengine wa chini, hawa wajua kali kama sisi, mutangoja sana. We are yet to pay until you make things work, until you make things right. God bless you, ladies and gentlemen. If you're watching this, kindly make sure you click the subscribe button and remember to turn on your notification bell. God bless you. See you in the next episode. Asanteni sana. Mungu akubariki.